Hey, hey, we are waiting for the beautiful Tani to join us, and we will get started with our great topic today for live. Speaking on some wonderful topics that will help both our stroke survivor and our caretakers. And we'll get started. There we go. Hello.
Hello.
How are you?
Good. You look stunning. I was gonna say, I'm like, dang, you got like the pearls on, the
Oh, thanks.
glasses, looking so pretty, and I'm over here in like a hat. I was like, okay, I look like.
Oh, baby, you always look beautiful. Always look beautiful. Always. It feels like it's been a minute, even though I just seen you a couple days ago. But I think the part that feels like it's been a minute is so much has been going on. So much has been going on. And haven't even talked to you about, anyways, hey guys, we usually meet up quickly and talk about what we're going to talk about. So I'm about to throw this at Toni, but I already know she can relate because it's something we deal with all the time. So I'm going to give you a quick synopsis of where I was yesterday. I was speaking with another survivor, which is a caretaker of a survivor, and she had some questions and concerns about the care that her loved one was getting in the hospitals and what to expect from her recovery, all of the above, and then things that she was considering that she may want to take the extra step to do with dealing with the loved one to make sure they had proper care. So it turns out to be the conversation centered around the lack of empathy, patience, and the unknown of medical practitioners and what's to come for survivors. So that's a whole nother topic in itself, which I say because I wanted to talk to you first. We'll touch base even deeper on that next week because it's so huge with that. But today, I wanted to bring out the situation with this trauma. And so yesterday took me to where I'm at today with this whole trauma situation to understand. And I'm actually going to back up and say yesterday plus the weeks before with this whole month of everything we've been dealing with together has brought me to this conversation that we're going to talk about today with trauma. And when I say trauma, and somebody said something, I wrote it down so I can quote it correctly so we can understand what she said. And actually, it was Pastor Sarah Jakes that I was listening to her message. So I'm going to go with this. It says, trauma is not just what happened to you in the moment. It would be different if it just happened to you in the moment and it was finished. So listen, that resonates to us so big. And it was just finished in that moment and you could move on without ever having the residue of what happened to you. And that's the situation. Us as stroke survivors, we are left with that residue from the trauma. And some may say the trauma for what? The trauma from our brain injury, traumatic brain injury, the trauma from this disease that happened to us, the trauma from the disability, the trauma from life after, the trauma from every day that we're dealing with, because every day is progression. It's a journey that we're on, that we're left with from the day we survived that stroke to the rest of our life. This is a journey. So to the natural and the unnatural eye, Tani and myself, and this is why I said this whole month, Lord, I've had a lot going on this month. Tani and myself looks normal or doesn't look like anything is happening to us to the natural eye. So I'm going to say that to say the person on the outside may look at us and say, hey, you really don't have a situation, or you can't relate to me because you have not gone through what I've gone through, or why do you feel you can relate to me because your situation is better, or because I can't physically see your disability, or I can't physically say because you don't have a physical something that you're left with, I can't relate to say, hey, you have a problem, is what I'm trying to get at. So because I'm not still twisted, because I'm not still walking with a limp, because my face isn't twisted, or I'm not sorry, and I'm speaking of all the things that I had to go through as soon as coming right up out of the stroke, you would look at me and say, you don't really have a problem. And I'm saying that, and I'm going to tell y'all why I'm saying that, because I've experienced something with medical professional, just as I'm saying something to me in the sense that you don't really have a problem, you're just babying your situation. And sorry, because y'all know I don't like to cuss on here. Listen, Listen, Tracy wanted to come out and give her all types of, but I had to tell her, ma'am, I'm going to pray for you because a person like that should not be in the medical field at all. Because for one, she lacks empathy, she lacks knowledge, and I mean, it's just where do you?
Bedside manner, have an inside
Yes.
voice.
Like, how do you, and you call yourself a medical practitioner to, we're supposed to entrust ourselves into the hands of you that lacks empathy, that lacks knowledge and understanding, because to the naked eye, and she's the naked eye, even though she is a medical professional, her naked eye says, hey, the stroke survivors that I've seen or textbooks or statistics have told me is they're physically paralyzed and they can't do anything. This person walks in front of in my office and says, hey, she's a stroke survivor. And I say, she's lying. So go back home because there's nothing wrong. What are you in my office for? I can't help you. Listen, that right there, when I say, so it'll take you back. By the grace of God, I was able to get up and keep rolling from that. But the thing is, not everybody has my faith. Not everybody has the strength that I have. Not everybody can take something like that and keep moving. Something as ill as that to say to a person that has a traumatic brain injury, that's dealing with their trauma still every single day of their life, to say that you can sit them back years based on how it hits them. So it's not something that you can say, hey, I said, okay, I didn't mean it, but you said it came out of your mouth, and that's how one perceives it from there. So again, I'm gonna go back to what I said as the problem with trauma is, and I'm gonna look where I was at. The true problem with trauma is that it anchors you in existence that doesn't necessarily align with your present, but because you are anchored in that moment, you cannot see yourself properly. So I said that to say, if I'd allowed that to sit with me, honey, I would have not been able to continue to proceed with everything that I'm doing. But just as simple as it seems simple for that ignorance of that medical professional to just spew that out of her mouth, thank God I had the ability to get up and keep going. But then it goes back to, I don't feel that I should always have to, what is the word
Brush it
I'm
off.
looking for?
You shouldn't just have to take the role with it. Like, it's like I shouldn't have to
Yes,
defend myself. You're supposed to be on my team. You're
exactly.
supposed to be my provider. We are not against each other. We're on this journey together, and the fact that I already present fine, people, it's hard enough for me to bring up my issues. I
Yes.
find I gaslight myself. I'm like, it's not that bad, but it is. And I just think the fact that the medical professionals question you and make you have to, I don't defend yourself. I don't know
The
any other
thing,
word.
and it's not right. So the thing is not right because of the simple fact that, again, that's entrusting in them to take care of us. But then it takes me to really the conversation I had yesterday of this love of this caretaker worried about their loved one. I can voice what happened. There are still in the first phases of their stroke. They can't voice it because they're still dealing with big time aphasia, still dealing with the healing of their brain because she's still missing a piece of her brain. So she can't voice this for herself. So me, a person that's up out and I can voice it for myself, I'm still dealing with this today. So imagine what the hell they're dealing with for the survivors that's fighting for their life in the hospital and they're left in the care of somebody that lacks the knowledge and empathy. And you chose this field. We didn't say, hey, throw you in there, this is the job you're going to do. No, stroke survivors, warriors, that once we made it, we were thrown in this. We did not choose this path. Hello, we just, boom, now this is where you are. Now you are a brain survivor. Now you are disabled. Now you have all of these things that we did not choose. But to be presented to someone that should be on the side to protect us, to say, hey, these are the things that we can do to make sure you get well, to make sure you keep pushing forward, to make sure you keep progressing, and then it gets slapped in their face. Come on now. So this right here is like, and we're speaking about it on this platform, but this is much larger than us because hello, we're small and we have a small community that the words may get out to, but you cannot go about life with doing that to someone and to speak and just so freely say these lack of knowledge. If you looked at the definition of ignorance, she was blatantly ignorant because of the simple ignorant is lack of knowledge. But ignorant and lack of knowledge and lack of empathy. How can you be in the professional medical world to not have any of those things and not have any tact about how you present yourself and how you come about to someone with a traumatic brain injury that's already dealing with disabilities, whether you see it or not, and then you say, "Oh, that's nothing." Where
Yeah,
again, again, we're fine.
or
Lord.
somebody else said their occupational therapist said, "Well, just have coffee if you're tired." Yeah, the neurofatigue, the coffee is going to cut it. It's just there's certain things. You've gone to school, you've worked with us. You would think you would, I mean, like I said, bedside manner, was that not a whole course or a class that you guys
Okay.
needed to learn? And we're hypersensitive. I remember crying many times getting off the phone with the doctor. And it wasn't the doctor, it was the nurse yelling at me about, do you really need to talk to him? Does this, she accused me of wanting more pain meds. She goes, "Well, some people just want those." And I go, "If you look at my record, I tried to get off them. If I'm telling you it hurts, something's wrong." Like, and she goes, "Well, then you're going to have to get scanned." And I'm like, "Good, scan me."
Okay.
Sure enough, built up spinal cord fluid. My doctor was like, "No wonder you say you're in so much pain." They were talking about having to put a freaking shunt in. And I was like, as the patient, if you look, it's not like I was always pushing the button asking for meds. So for you to just globalize and say, "Well, we have a drug problem, and because you're young and you have colorful hair, I'm going to think that you're a certain way," and it's just not okay. And caretakers, I used to say I was grateful my mom sat with me a lot, but I could hear them making the rounds, and sometimes I'm like, who's helping that person? Like,
No.
I remember telling the nurses to plug my leg cuffs back in so I don't have blood clots. That's freaking important. I shouldn't have to remind you of that. I'm the patient. And that was in the ICU.
And that's a problem because again, you're in ICU, you were able to say that. It
Most
just
aren't.
takes me to it makes me sad to think about so many people that cannot, that they have the thoughts in their head. And I remembering one thing the young lady said yesterday. She said so her loved one still can't quite get the words out, but she was like, she just something told her to just start asking questions, so she still couldn't say it. And she was like, "Can you give me a signal or something to tell me?" And she said instantly she had a piece of tissue and she threw it. I said, thank God she was able to do that. That was a sign saying, "Hey guys, stop ignoring me. There's something going on. I can't voice this, but I'm human. And what the hell? You guys are in this field to help people, and you're really not helping. You're coming into your job with your own opinion, with your own whatever type of bullshit you got going on at work, and you come into this person's into this patient's room and say, "Hey, she's just not cooperating today. Not cooperating today.
Or
Is the
can't.
lady missing half of her brain? Is still part of her brain open? Is she not cooperating, or is she struggling today? Or maybe she's having some extra pain today, or today is just not a good day because maybe her body is shutting down, even though on the outside it looks like, oh, she's good, but I can't." So her not responding today means she is being combative. She doesn't want to work today. She doesn't want to do
What
anything
if she's
today.
regressing? Like, what if that's a symptom of a bigger problem? Like, instead of jumping to, you just have an
Girl,
attitude, or you just,
it's it's so sad, and that's what I'm saying. I experience still today, but this young lady, she is, and it's because we have to be advocates for these people, but she can't be an advocate for herself. So the loved one is saying, "Hey, what should I do? What can I do? Have you experienced this? Like, what am I doing too much? No, keep doing more,
yeah.
keep doing more." And it's the problem because you're not doing too much, they're not doing enough, and they're looking at it as it's oh Lord, it's just it's I get lost for words to actually because and that's why I love talking to loved ones too, because I want to give them insight and I want to hear the things that they're going through because we need to help them because again they're trying to help the survivor, but at the same time they don't understand it. And she's like, "Am I stepping on their toes? Should I be worried?"
No.
absolutely be worried.
You should,
Absolutely be worried.
it's your right. I would rather be a squeaky wheel and be wrong than be dead.
Yes.
So I don't care. My mom, and I tell people, you know, she asked every single thing they injected me with. She had a notebook. I'm writing down everything. What are you doing to her now? What are you doing now? But not everybody has that. I know, having a patient advocate, having someone, and my mom, I know, cried a lot, wondering, same thing, am I stepping on their toes, or they do they hate that I'm in there? And I'm like, I need you to be there because I need you to ask the questions that I can't ask. Because
It's
even though in the appointment I am like this and I talk like this, so they think everything is fine, and I can tell you every single appointment, halfway through the drive home, I go, I will ask a question, and my mom's like, "Wow, you're just now." I go, "Yeah, just now processing all of that." I was like,
and that's what it's, it takes me to really, it needs to be more of an education. We need more education on how to properly care for, and I can't speak for everybody because and listen, I'm only, we're represented as advocates for stroke survivors. So us saying, hey, we need our medical professionals to be more educated, to have a sense of empathy, to have learn a new technique. I don't care how many degrees you got or what level of doctor you are. Somebody, everybody still needs to go through different levels of, hey, let's retest you on your bedside manner today. Let's retest you on your, and so just like in myself, as when I got licensed to become a personal trainer, I had to get retested, and it was just not retested. It was my own. Hey, there's new knowledge, there's new education, so let's go back to school. Let's get another education credit to see if you're still aware of the new techniques and the new things going on in the world. What about these doctors and medical professionals? How many times do they go back to say, hey,
well, just like your CPR training you do every year, there should
yes,
also be an empathy training where you see us as people. I get when you see car crash after car crash, you get desensitized by it. I understand that. However, that's why I love when they have the summits where they have patients and medical professionals together, because hearing our stories, seeing us as people, and hearing that it's not just one or two people, that a lot of us feel this way, is the only way it's going to change. But not all
that's so
doctors
true.
want to hear it or take the time to listen to these things. They're like,
They don't.
I'd rather go to take the course that's going to get me more money than to go listen to this person that's going to change how I care for my patients.
Oh, all the thoughts are going on in my head and I'm not going to go say what I really want to say
Like I
because
just did.
because like it takes me to the point as sometimes I just want to react in a way that and I'm going to say this out of not necessarily my character, but if I react in the way that you made me feel, listen, you'll be calling the cops on
Yeah.
me. But but
You're
the
lucky I
thing
can
is,
breathe.
yeah, but the thing is, how do you get to treat me like that? But if I responded the way you responded to me, we'd have a whole situation. That's a serious problem. Like, it's okay for you to do it, but for me to respond in the way that would have been respectful for me because you did it first. And for me to respond that way, it's we have to do something about this, y'all, because it's mind blowing to things that we deal with and people don't even know it that talk about
I will give one positive thing. My experience at the Cleveland Clinic, because I had the two different brain surgeries. Um, the first brain surgery was when the nurse practitioner was very mean to me. And luckily, the second time around, they did change things where you, you, and I don't want to say you rate them, but you can give them feedback. Because I did grow enough to be like, I, I just don't want her to talk to other patients like that. Like, she made me cry and she made me question myself. She made me, then when I was in pain, I felt like, am I being a baby? And like, my medical chart showed, you are not a baby. Like, if I say something hurts, my pain tolerance is so high, so if I even register it as hard,
it.
like that, there's a problem. And so I'm grateful that now they are doing those surveys so that you can say like, no, she spoke to me like this way. And so I used to feel like, oh, I don't want to make any waves, and I don't, and like, I don't feel that way anymore. I'm like, no, I'm not going to let you talk to me like this. I'm not going to let you talk to future survivors or caretakers that way. And my mom has even said, she's like, I've noticed that difference in you after the second brain surgery. Because before I would just like accept it. And I was like, I'm so physically exhausted from fighting my own health that I cannot argue with you. But now I'm like, it's not an argument. I'm just like, no, I'm not going to allow you to talk to me or people like this anymore.
And that's excellent. That is a way that we will be able to therefore get our voices out there, because I am one, and I'm gonna be honest, prior to I would be like, okay, why are they sending me a survey? It's not like they're gonna do anything. But baby, after that, and it took me a minute to process it even still. The fact that a week later I'm like, okay, that still bothered me. Guess what? I am speaking loud and proud about it. I'm going back to, hey, what was her name? How long has she been? Because this lady needs to retire. She needs not to ever deal with anyone. Because when I say, and I'm downplaying it, but it was ridiculous. Absolutely ridiculous. And in layman's terms, it was like I walked in the room, hey, stroke survivor, you ain't really no stroke survivor. Why you in the office? That's basically what she did. So, okay, what am I supposed to do? All right, maybe stop babying your situation and keep walking. Baby, I can smile today. I mean, I was like, did this just happen? To the point I had to sit in the car for like 45 minutes, like, excuse me? Like, did she really just do that? And I was like, okay, this is, you have to voice it, because so many people go through this and they can't voice it.
You are allowed to cry. I know. I'm grateful that you're letting it out, because it's so hurtful, because it's hard enough. You're like, I already have enough people telling me, and then to have like a medical person. And I know that's why I got misdiagnosed. Like so many of us, that's why we suffer silently, because we've had somebody just tell us like, you're just being a bit, like, it's not that bad. You're fine. I mean, my brain literally blew up and he told me it was a migraine and numbed me and told me to go home. Like, you had her look at, I mean, within just talking to you for a couple minutes, you see your determination and how hard and how much you've overcome. Like, so, gosh, I just appreciate you.
Sorry.
No, don't be sorry, but that kind of a change is like, that's good. And I literally told my doctor, can we stop this crying stuff? Like, I wanted him to fix this in me. And he goes, how about you almost died and you got a second chance at life? And like, yeah, it is emotion regulation. We have a hard time, but how much we love is how much we cry. It's how deeply we
Absolutely.
feel. So when people say those things, like Tracy has done this whole thing smiling with a smile on her face. It wasn't until at the very end that you were like, I'm actually feeling what she said to me. And that's
Yes.
not okay to feel that. To have someone whose job is to be on your side talk to you that way is inexcusable.
But I mean, that's the thing. If we don't talk about it, they're going to keep doing it. And it's
They
affecting so
will.
many people in so many ways that, again,
Just
I'm going to keep repeating myself, that can't voice it. Like this lady, and it made me so mad hearing how this young lady was treated yesterday. I'm like, and I mean, Tommy, when I'm like, they said that they don't understand. I said, and I had to go back. I said, wait, take me back. Is it a piece of her brain still missing? They're like, yeah, they haven't put it back on. And then you're so quick to say, hey, she's being combative. She's not wanting to work today. Bitch, she don't have her brain. She has
I
missing
would
half of her
be
brain.
like, do we need to scan her right now? Is her brain swollen? Is something going on? Like, this
Exactly.
is
Y'all
not like
need
her.
to see what's going on with her. There's something going on. So instead of you just being so irritated, okay, I'm going to move on to the next patient. Hey, let's take some extra time to see. Hey, let's see if something is possibly wrong with her today. Let's see if we can help her in another way. But you're so quick to judge and so quick to just impatient and not have any bedside manner or empathy. You're like, we not working with her today, and if she doesn't get it together, then we're just going to kick her out of therapy. I said, wait a minute, Lord have mercy. This, y'all seriously? Like, and I'm like, what facility is this? Like, yeah, no, please, you have to be a voice for her. And it sucks to say, like, hey, unfortunately, you need to be there every day with her. But these are people that still have regular jobs. She can be.
No, I know.
So then the person is just asked out on their own. Like, seriously, that's not cool. But, Lord, we are in this situation, y'all, that we need to voice this. And medical practitioners, I hope y'all hear this. Y'all got to do better.
And
y'all need to go back to the beginning of y'all need continuing education credits as us and these other the ones that have these small licenses certifications, how we have to keep ourselves updated on what's new and just challenging ourselves like you said. And all doctors, they got to go through CPR every year again. Hello, but it needs to be mandatory. Okay, forget just CPR. Yes, that's something you need to learn. Empathy, bedside manner, patience. Like if you fail that, which half of them will, then take your ass back to school and start over, so you don't get or be set on administrative leave until you could come back and pass this correctly.
I just have to say it's the only profession that I know, like if your car was broken and you took it in and someone talked to you the way that a doctor sometimes talks to us, you would not go back to that mechanic. Okay. Absolutely. And guess what? That mechanic wouldn't have really good reviews and that mechanic would eventually close down. But the problem is that a lot of them, there's no repercussions until we are now getting louder. So that's why I'm grateful. I also write when they are amazing. I love to take down the nurses when she goes above and beyond. So I'm not just saying I complain when things are wrong, but like what Tracy said is so many people can't speak up for themselves. The survivor guilt that I have is exorbitant. That's why I get so loud, is because I laid in that hospital and I heard them go around and I could hear how with it I was and I could hear how everybody else, and I was like, and they only let one person in at a time, and like Tracy said, you don't have someone with you all the time. No. And I was like, I want to get up and go check on them and like I can't, and like, so the more of us just getting loud. So thank you for sharing about this other survivor and caretaker and just being vulnerable.
Yeah, we're gonna listen. I said I'm gonna go back. I'm gonna start praying because the Lord got to do something. Because honey, the way I want to react to some of these people that do this, oh Lord, yeah. Thank God I'm a Christian. Because the things that I could think about, I could have did to that lady. Like that's how pissed I was. Like,
oh, I bet that's what I was like. Good thing I've gotten older and my mom raised me right, and I'm learning.
Yes. Yes. I mean, listen, that's why I smile most of my days, and I thank God for new life and patience and faith because, listen, I want to keep living a free life, is what I'm going to say. That's how bad it was. I want to keep living a free life.
And a person, feelings are temporary. So I just want to, we have all could sit here and talk about all the time something bad, but I want you for a moment. Guess what? We are alive and we can change things, and it doesn't have to stay that way. And you can find a different doctor, you can find a different nurse. I know it's really, really hard. Trust me, I was stuck with a bad one. But collectively, that's why us getting loud together does make a difference. That's all.
I love you, Tony, and that's it, because I don't have nothing else to say. That is the end. We will see y'all, and I appreciate y'all tuning in today. We are early, so we will see y'all next Thursday, same time. All right.
Okay, bye guys. Love you.